بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. أنا أمال الطيان Senior Nursing Student. أهلا بكم وحياكم الله جميعا في جامعة رياض العلم. السلام الملكي. خير ما نبدأ به آيات من الذكر الحكيم لننصت له مستمعين.
الله نور السماوات والأرض مثل نوره كمشكاة فيها مصباح المصباح في زجاجة الزجاجة كأنها كوكب دري يوقد من شجرة مباركة زيتونة لا شرقية ولا غربية يكاد زيتها يضيء ولو لم تمسسه نار نور على نور يهدي الله لنوره من يشاء ويضرب الله الأمثال للناس والله بكل شيء عليم.
حياكم اليوم لحضور لقاء كلية التمريض في جامعة رياض العلم تحت عنوان التأقلم مع الاحتياجات المستقبلية للتمريض في المملكة العربية السعودية. ويدير هذا اللقاء سعادة عميدة كلية التمريض في جامعة رياض العلم دكتورة تهاني الرهبيني. Dr. Tahani Rahbini is an associate professor in molecular toxicology and genetics. She got her bachelor and master's degrees from King Saud University, the College of Pharmacy. The PhD in molecular toxicology and genetics was attained from the University of Aberdeen, Scotland, United Kingdom. Dr. Tahani worked in National Guard Hospital followed by the Ministry of Health and joined REU in 2004 as a part-timer and switched to full-time faculty in 2006. Since then, Dr. Tahani has progressed in ranks, reaching the Dean of College of Nursing in 2018. Dr. Tahani is interested in research and has published a number of articles and book chapters. Also, she established the well-known and successful REU Summer Research Program. In addition, she is the head of the Strategic Planning and Policies Unit at REU. Without further ado, Dr. Tahani, please, the floor is yours.
السلام عليكم ورحمة الله وبركاته. أول شيء أهلا وسهلا بكم جميعا في جامعة رياض العلم وخاصة كلية التمريض. أود أن أرحب بسعادة العمداء سعادة العميد الدكتور حمود والدكتور محمد الرافعي، شرفتونا. ويسعدنا اليوم في كلية التمريض في جامعة رياض العلم تنظيم اللقاء الأول لنا بعنوان التأقلم مع الاحتياجات المستقبلية للتمريض في المملكة العربية السعودية. وبالبرنامج حنستضيف عدد من الدكاترة المعروفين وحنبدأ مع الدكتور عبد الرحمن الشهري. So currently Dr. عبد الرحمن الشهري is a nursing consultant and an associate professor in medical surgical department at the College of Nursing in King Saud University. Dr. Shihri worked in clinical area and since he got his diploma in nursing since 1998 until he transferred to King Saud University as a lecturer in June 2009. During the previous time, he did his bachelor degree as a bridging program in the Applied Science University in Jordan and graduated in 2004. And then Dr. Shihri did his internship bachelor degree for 6 months in Bradford Hospital in UK, England. And then his master's degree was in clinical care nursing at Griffith University in Australia, and he graduated in 2006. And his master work was from John Flynn Gold Coast Private Hospital in Australia for 1 year. Dr. Abdurrahman has a mixed clinical experience in Saudi Arabia. So he worked in the Ministry of Health, King Faisal Specialist Hospital in different areas and departments. Finally, he got his PhD in 2016 from the University of Massachusetts, USA. Since he came back, he worked in the College of Nursing. And beside that, he works as a consultant in different projects and different universities. Dr. Abdurrahman currently is working as a consultant in our university. Thank you so much. And Dr. Abdurrahman is the founder of the Follow-up and Compliance Unit in all private universities and colleges under the Ministry of Education. And he's also the founder of Innovation and Entrepreneurship Unit and the founder also of Business Unit in King Saud University College of Nursing. Finally, he is a member of the Australian College of Critical Care Nursing and the Royal College of Nursing Australia. Also, he is a member of the Saudi Council of Health Specialities and evaluator for nursing specialities. Thank you, Dr. تفضل.
بسم الله الرحمن الرحيم، الصلاة والسلام على أشرف خلق الله سيدنا محمد وعلى آله وصحبه وسلم أجمعين. Good afternoon, everyone. Thank you, Dr. Tahani, for these introductions, and thank you, Dr. Muhammad, for letting me to participate in these events. Today, I will talk about the development and need for nursing in Saudi Arabia. As we know, nursing is very important in any healthcare organizations. They are considered as the backbone of the hospitals. It's not because they are better than the other healthcare providers, but because they are the majority of numbers in healthcare institutions. So, since we have our objective today is to give overview for the history of nursing, to highlight the development of nursing profession in Saudi Arabia, and to identify the current and future need nurses in Saudi Arabia. We know that nursing, as we said, is very important, and since we have some audience from high school, we have to go a little bit to the basics. And we have to define the nursing because I am sure that they go to the hospital, they have seen the nurses in the hospital, they have seen the other healthcare providers, but they don't know, or maybe they are not able to distinguish between the work of nursing and other healthcare providers. And therefore, the nursing is a profession that require compassion as well as expert, making it both art and science. We have different definition for nursing, but what I like about this definition specifically is highlighting the science of nursing. So for us in nursing fields and for the students to understand, especially the high school students, to know that the nursing is like any other scientific fields, we are producing nurses who have a bachelor degree, master degree, and PhD. So the people who have a PhD in nursing, they are able to work for any issue in nursing. They have to analyze it. They have to go through the step of nursing research to be able to get to the solution of that problem. And that's why they became a scientist, and we know them as a scientist. For the second part of the definitions, which talking about the art of nursing, we know that if we have the results of the research and we got the result of that research, it doesn't mean anything to us unless we use it in the clinical practice. And that's why we use all the nursing research implemented in the clinical practice to have a very good clinical output for our patients that they deserve in Saudi Arabia. The art of nursing, as it's coming in the definitions, is the way how the nurses are able to practice in the clinical settings. Because Abdurrahman is different from Hamoud, from any other nurse when it comes to the clinical practice. Because we are innovative. We try to build our students while they are in College of Nursing to be innovative enough to be able to develop the nursing care for the patient in innovative way that distinguish each one from the others. And that became an art, because we have some figures of nursing. I've been working in Ministry of Health, King Faisal Hospital, Jordan Hospitals, United Kingdom, Australia. So I have seen how the nurses are practiced. And there are some figures in the department that they are really very well known when it comes to how they apply the knowledge in clinical practice. And therefore, I'm strengthening our nursing students in Riyadh Al-Ilm University to get the opportunity to be able to observe the clinical practice when they have the participation of the clinical practice of the subject in the hospital. However, nursing, as we said, we are not different from other healthcare providers, but since we are spending a lot of time with the patients, more than any other healthcare providers, we build a relationship with the patients. We understand him. We know all the problem that he is evolving in other than his clinical issue or his clinical problem. And that's why we have a good empathy to build with that patients. Also, it is a compassions and is the ability to feel the emotion of those patients and understand them, and to be able to help them, because when they come to the hospital, we know that they are in a point that they are not able to help themselves, and they came for us to seek the help. As saying that, the nursing fields with the definitions for the people who don't know about nursing and the definition of nursing, in order for us also to present ourselves, we have to look back to our history. The history of nursing has a very long time, and it is really important for us to know that and to share it with other people to understand the history of this field. History of nursing have different branches. The Western nurses are looking to the nursing from the perspectives and the history. We are highly respected that, and we know that the history of the fields is from everyone, not from the people who are in Saudi Arabia or the people who are in Arab countries or Muslims country. We are working together, and we need to initiate that. So my topic today will talk about the history in two different categories. So we will take the perspectives of Western country. Also, we have to know our roots in Islam and how it is evolved and involved the nursing in Islam. Saying that, I want to introduce one of our students in Riyadh Al Ilm University, which is, she will talk about the history of nursing in Western country. Dina, please, the floor is yours. They are relying on you to help them.
Assalamu alaikum, everyone. So today we're talking about the history of nursing. So in 1854, Florence Nightingale and volunteers provided care during crime and war. The work of Florence Nightingale showed the importance of women nurses and the strict for sanitation practices. She helped reducing death by 2/3. Today, she is considered as the founder of modern nursing. In 1855, the establishment of Nightingale Fund in recognition of the effort of Florence Nightingale to the war, several special individuals were together to establish the nursing fund. They raised 45,000 euros to establish the first nursing school. The fund remains influential today as a modern charity. It covers nursing schools fees. In 1873, multiple nursing schools founded, a landmark year of education. The founding of several prestigious programs, for example, the Bellevue Hospital, the School of Nursing, initially focused on hygiene and patient comfort. For 1896, we have the Nurse Associated Alumni Assemblies. They formed with hopes and advancing the nursing professions. The purpose of establishing and maintaining code of ethics. As for 1915, the National League of Nursing Education presents a standard curriculum. The League took a major step by presenting a standard curriculum for nursing college. As for 1925, Committee on the Grading of Nursing Schools. Many excellent curriculums resources were available, but nursing education still required additional oversight and accountability. Therefore, they formed a committee on the grading of nursing schools. In 1947, the National League of Nursing Education sets a goal of bringing nursing to higher education. So after World War II, nursing programs expanded rapidly, but mostly initially involved diploma schools rather than encouraging aspiring nurse to enroll for a 4-year college. In 1948, the Nursing of Future published. It's worth standardizing nursing curriculum. As for 1970, the LISAT Commission provides recommendation for nursing education. They recommended statewide planning that would determine how the nursing programs would be distributed. In 2008, the consensus model of advanced practice registered nurse regulations started to have the licensure, accreditation, certification, and education. In 2010, the Institute of Medicine releases a report on the future of nursing. The future of nursing advocated for the removal of limits of nursing scope of practice. So they encouraged nurses and nurses organization to start the nursing scope of practice. The report also mentioned the need of nurses to obtain the bachelor degrees while encouraging to seek higher educational level. In 2015, OSHA, the Occupational Safety and Health Administration, issues guidelines to improve nurse safety. They encouraged hospitals to take seriously comprehensive program for the mobility and the safety. As for nurses ranked the most ethical professionals between 1999 and 2020, an annual Gallup survey of the most trusted professions has placed nurses at the top among the other healthcare providers. Last but not least, COVID transformed nursing from 2020 and beyond. With the onset of COVID came increased pressure on the hardworking nurses. They dealt with long hours, a protective equipment shortage, and stress of healthcare system. In response to all that, nursing professions have overcome. So the World Health Assembly has referred to 2020 as the year of nurse. Thank you. Thank you, Doctor.
Thank you, Dina, for highlighting that, which is very important for us in nursing. As I said, also the history, it's not only in Western countries. We have our history for nursing in Islam. And Islam has also pushed us to work together and help each other, especially if they are in need. Saying that, I want to welcome also our students from Riyadh Al Ilm University College of Nursing, Khalid Al Qahtani, who will give us an overview for the history of nursing in Islam.
Assalamu alaikum. Ladies and gentlemen, welcome and thanks for your coming. And it is my pleasure to present this lecture today. Actually, Islamic literature has a different view of nursing. The first of all, nursing in Islam started in the era of the Prophet Muhammad alayhi salatu wasalam in the 8th century. This is occurred when the Prophet Muhammad alayhi salatu wasalam recognized nursing caregivers as a crucial part of the Muslim army. Nursing care in the religion of Islam is the manifestation of love for Allah and the Muhammad alayhi salatu wasalam. During the pre-Islamic era, nursing work was acknowledged within the faith as a begin, sponsored and actively encouraged during the pre-Islamic period. The role of Arab women focused on reassuring and encouraging males to fight. Muslim women worked as volunteers in the battlefield, providing the first aid and wounded care to the soldiers. During the period, nursing gained strength with the participation of women as volunteers, causing an exhibition for nursing as a religious duty. Nursing service in Islam were not limited on the war period. It was documented. Documented in Islamic literature that Rafida bint Sa'd al-Ansariya was recognized as the founder of nursing in the Islamic era, many centuries before Nightingale's time. Rafida's father was a physician and was a thought that she developed her knowledge and training in nursing skills as she assisted regularly with the caring for patients and soldiers. In addition, She was a nurse educator, and during times of war, she practiced nursing by teaching and training Muslim women in the tent with the permission and support of the Prophet Muhammad alayhi salatu wasalam. She established a small tent in Al-Medina, near of the Prophet's mosque, which is now recognized as the first protopale hospital in Islam, in order to treat injured soldiers and solve social issues. In her tent, many volunteer Muslims were learned nursing skills, enabling them to give care for ill and wounded Muslims. Rafida is described as a model nurse and a leader and a great teacher, passing on her clinic knowledge with the others she trained. Rafida, she didn't limit nursing practice to the clinic field, but went out into the community to address and solve social issues that contributed to disease. Welcome. In the end, I want to add something. Rafida was both public health service and health nurse and social worker. Thank you so much, and I hope you like it. Have a good day.
Since we know the history of nursing, we need to know also what is the history of nursing education in Saudi Arabia. As Saudi Arabia, nursing education is divided to three parts. As I say, or as I mentioned, it is three paths. The first path is starting with the health education started in Riyadh in 1959, where the Ministry of Health worked with the World Health Organizations to establish the first health institutions in the country, because the Ministry of Health in that time realized the problem of raising the national nurses so they can help our patients. And therefore, they established this first program for boys, and 1 year later, they graduate the first batch. In that time, the nursing are studying after the middle schools is only 1 year program. In 1961, nursing school for women were open in Riyadh and Jeddah. So another branches are open there. So it helped the other city as well in the country. In 1967, the Department of Health Education and Training was established by the Ministry of Health also. The main aim for this department is to look for the curriculums and to look for and supervise these institutions to be able to let them teach in a correct way and make safe practitioners. In 1979, the Department of Health Education and Training developed the nursing schools. So they started to increase the branches of this healthcare organization, of this health institutions, and the first graduation from this development school was in 1982. By 1992, there were a total of 48 health institutions around the country, which is given us to the view of how the health, the Ministry of Health view the problem and start to solve it. So in 1992, a number of these institutions was upgraded. So the Ministry of Health start to innovate more and look for different angles. So they realize that with the middle school students, it is not enough to give them only 2 years certificates. And that's why they accept only students who are from high schools to give a diploma in nursing for 2 years or 3 years in that time. So, and the first health institutions for diploma was in 1997, which is the one I graduated from. During 2008, all of this education organization was transferred to the Ministry of Higher Education. And I really support that because the Ministry of Higher Education need to recognize all that. The second path is the other organization or other institution that was supervised by the Ministry of Education in that time before they changed it to Ministry of Education now. It was the Ministry of Higher Education. So they established the first nursing college in 1976 in Riyadh here in King Saud University, which is the first nursing programs in the country. In 1978, unfortunately, the acceptance rate and because it was very high, so the nursing students are very limited. And that's why as a college, they have a number of students that they can keep to be as a college. That's why it was absorbed by the Applied Medical Science College and be only a department, which is downgrade for the college itself. However, apart from King Saud University in that time, because we know King Saud University have branches all over the country. And from that branches, when the innovations come through King Abdullah, rahimahullah, he started another university from these branches. So a part of King Saud University, there were two nursing programs were initiated in King Abdulaziz University in Jeddah and in 1977, and King Faisal University in Dammam in 1987. The master program in nursing was also begun in King Saud University in 1987. So, and maybe my colleague, Dr. Hamoud, will elaborate in the master program or postgraduate educations when he will start his talk. Since 2004, however, the number of male nursing department has been established in many college and university around the country. And again, King Saud University start to accept male nurses. And I realize here, when I did my bachelor degree, there was no program for bachelor degree in the country. And therefore, we've been transferred or we obtain our bachelor degree from overseas. So in 2004, the Department of Nursing was once again upgraded to be a full college in King Saud University. In 1994, the PhD program was established in King Abdulaziz University. So if you look to the history, this program was started long time ago. But unfortunately, this is a program that make a collaboration with one university in England, and for some reasons, 2 years after, they stopped these programs, unfortunately. However, King Saud University take the lead now and they start the first PhD program in the Middle East in 2019. And alhamdulillah, we have 2 batches who graduated from this program. The last one of these students was yesterday his defense, and the day before yesterday was the students of Dr. Hamoud. He also graduated from this program. The also private university is also very important to support the governmental university. So the first private university in Saudi Arabia was King Abdulaziz University. And it is not very well known in the literatures, only in few literature that it's highlighted that. So they started that in 1967 as a private university because they realized that in the western regions, there is no university in that area. And that's why they think about opening that university after one of the writers in Al Madina newspaper, he wrote about the importance of opening nursing private schools. So some of the business people in Jeddah give the lands and they build these institutions for the students in Jeddah. However, with the time, unfortunately, because the students in that time, they did not pay for the program. The program was relying only for the donations. And therefore, the donation was not enough to let the university be succeed. And that's why they think about the board of trustees, they ask to the government to handle that university. And therefore, the government hold that university and let the student get in. So in 1992, the Ministry of Higher Education start to think about the private higher education again. But because of the bad impressions and the bad experience that happened with the King Abdulaziz University, they tried to delay that. But in 1998, the cabinet of the president requests the Ministry of Higher Education to give a detailed proposal for starting non-profit higher education institutions. The Ministry of Higher Education take that in the considerations of the 5 plan of the ministries, and in 2001, the cabinet of the president approved the general regulation and rule for the private higher educations, and therefore they started in 2002, the Ministry of Higher Education approved that exclude regulations, and they started the first 2 universities, King Faisal University and Prince Sultan University in 2003 as non-profit university. In 2004, Riyadh College for Dentistry and Pharmacy established and became a university in only 14 years, which is very young for a university to move from college to a university. We are very glad for Riyadh Al-Ilm University. In 2007, the King approved the internal scholarship, and therefore many of the college, they start to open nursing colleges and programs, and it is around the country now. So what was the reason for thinking about the private higher education in Saudi Arabia? It is, of course, the demand on higher education has been beyond the capacity of the private or public sectors. Providing an access to some students who cannot achieve admission to the public university, and this was really bad for people who are living in rural area, because they have to travel to the city, the big city, so they will be able to study a bachelor degree. The private sectors, as shown in the Ministry of Health, Ministry of Education, as I've been there working as a consultant, the private university proved that in terms of they are higher than some of the governmental university in terms of teaching and learning, extracurriculum activities, emphasis in practical classes and assignment, and internship for the direct contact with the patient. So this is another plus for the private institutions in the country, and we are aiming for more, inshallah. The third part of this nursing path is some institutions that they realize they have a problem with the nursing staff in them institutions. And that's why they started to have an institution that they can teach the students graduated and work for the same institutions, starting from medical service of army forces, National Guard Health Affairs, Prince Sultan Cardiac Centers, King Faisal Specialist Hospital and Research Centers, and also King Faisal Hospital go beyond that and make a contract with one university, Monash University in Australia, to start postgraduate education in that time. So we know about the history, we know about how we evolve and get to the private education and governmental education with different institutions of academic. So we want to know what is the current and future need for nurses in Saudi Arabia. Statistics show in 2020, the total nurses in the country is 196,701 nurses who are working in the government and private sectors. However, only 84,384 nurses, which is around 42.9, were Saudis. 112,316 nurses, around 57.1, were non-Saudis. And we are proud of that. And I will tell you why we are proud of that. By 2030, we need more than double as the population continue to expand at 2.52% yearly, which is very big. This means that by 2030, we need around 150,000 nursing positions should be filled without relying to foreigner recruitments. We need 10,000 nurses yearly produced or graduated from our nursing school, which is beyond our expectation and our ability. And therefore, we are highly appreciate all the nurses, all the non-Saudi nurses who came to help us. And as the statistics indicate that we are in crisis, we highly appreciate them efforts. They sacrificed them times and they came to help us in this time. The number of nurses produced in Saudi Arabia compared to selected number of organizations in some countries, as we can see, Saudi Arabia has only 10% compared to Australia, which is 78.9, which is very, very, very low. However, with all that, we have a very high turnover rate in Saudi Arabia, which is really put all the health institutions in crisis. The Saudi Arabia have a 20% turnover rate yearly, which is double of UK alone. So what are the factors affecting localization of nursing? I know I am behind the time, but I am in the last slide. Internal factors that institutional support the administration leadership convincing to community toward the workforce localizations. We have to have also incentives provided to the citizens, such as increasing wage and improving the working conditions. The role of organization culture in the process of workforce localizations. The external factors, which is beyond the institutions, negative attitude of citizens toward the nursing professions, the availability of national competency compared to the foreigner competencies, the preferences for foreigner competency over local competency in terms of achieving cost-effective productivities, and some business owner avoid the obligations of workforce localization plan in the country. Unfortunately, they are doing that. The conclusions, Saudi nurses need to continue getting the experience from our colleague nurses who came to help us during this time. The development of nursing education need to be continuous, and the workforce localization need to be observed around all the institutions. Thank you very much for your listening. A special thanks to all the nurses here in the country, not only Riyadh, but all the country. The foreigner nurses who are working with us, we highly appreciate that. We thank you for doing that and helping us. I also want to thank Khalid and Dina. Please welcome and thank you very much for all your help to present that. Thank you.
يعطيك العافية, Dr. Thank you very much for this holistic, and thank you, my lovely students. I'm always proud of you, and you always make me proud. Every time I see something from you new, it makes me really happy. الآن نرحب بسعادة الدكتور حمود الحربي اللي عميد كلية التمريض بجامعة الملك سعود. Dr. Hamoud Al-Harbi is a consultant nurse and an associate professor in medical surgical department at the College of Nursing in King Saud University. He is serving also currently as the Dean of the College of Nursing. Dr. Hamoud got his diploma in nursing in 1998 from Breda Health Institution, his bachelor from the Jordan University in Amman in 2004, and master's from Griffith University, Australia, 2006, Finally, his PhD was acquired in 2015 from Kent State University, Ohio, USA. Dr. Hamoud experiences it's a wide range of experience from working in the Ministry of Health hospitals from 98 to 2000 and King Faisal Specialist Hospital and Research Center from 2000 to 2009. And he worked in different departments as neurosurgery, medical surgical, intensive care, and cardiac surgery, intensive care unit. Also, Dr. Hamoud participated in research and scholarly to his professional activities for over 10 years, and he published more than 22 articles, mashallah. Finally, Dr. Hamoud is also serving in many committees inside and outside the kingdom. Welcome, Dr. Hamoud. Tfaddal.
السلام عليكم ورحمة الله وبركاته. Good afternoon, everybody. It is really my pleasure to be here to participate in this great event. First of all, I would like to thank Dr. Muhammad Al-Rafi'i, the president of Riyadh Al-Ilm University. Special thank Dr. Tahani Al-Rahbini, the dean of the nursing college. Also, special thank to Dr. Abdurrahman. He is my department chair, and hopefully this year, inshallah, he will give me a good praise, inshallah. And special thank to Khalid and Dina, mashallah, they were great presenters. Today I will be talking to you about the post-grad studies in Saudi Arabia. These are my objectives: to go over a view of the post-grad nursing, postgraduate nursing programs, to discuss the APRN roles, educations, and salaries. These are very important to discuss it to understand what's the difference and where we are in terms of the post-grad global-wise. Also, we'll discuss the non-clinical specialties. تفضل. صوت بعيد. ما يتحرك هنا. Also, we would like to discuss the non-clinical specialties, roles, educations, and salaries, and to elaborate on the needs and challenges of the postgrads in line with the 2030 vision. So let's start with grad studies. When we said postgrad, this means that they finished. What is the grads? Graduates, it's nurses who already completed their academic studies, but they haven't completed their licensure exam to become RN. So everyone who finished the BSN but hasn't completed the licensure exam, it's called graduate. Postgrad nursing programs are any studies that the students or the practitioners gain after the post BSN, which may include a clinical MSN, non-clinical MSN, a graduate diploma, or a graduate certificate in nursing care that facilitate career specialization for better nursing outcome. This presentation will be focusing in the advanced practice registered nurses, which is abbreviated as APRN, and non-clinical, these are clinical MSN, and we will be discussing the non-clinical MSNs. So let's start with what is APRN. Are graduates who earned the graduate level degree, the studies such as MSN or DNP, and has been specialized, specially trained in one of the 4 recognized APRN, which is nursing practitioner, NPs, CNS, which is clinical nurse specialists, and certificates, nursing midwives, and certified registered nurse anesthesiast. While many people use the term APRN and NP interchangeably, there is a big difference between APRN and NPs. All NPs are APRN, but not all APRNs are NPs. This means that APRN is a broad category. You could have NPs and CNS behind this umbrella or under this umbrella. APRN can be specialized in many populations, such as family or individual across life span, neonatal, women health, adult gerontology, pediatric, psychiatric mental health, and critical care. So we could have CNS in all these specialties, and we could have them NPs in the same time. This is based on what we need. Do we need NPs and like neonatal, or we need CNS? And it's going to vary according to the need of each population. I will start with the CNS. CNS are licensed and registered nurses who specialize in providing advanced patient care and problem here. One Khalid. Be annoying. There is something here, Natish. طيب. Here. طيب. Their duties include clinical practice, research, and managing and training staff. They work at hospitals, clinics, and other healthcare facilities, and they may be involved in administration as well. CNS educations, Master of Science in Nursing. They will be studying 2 to 3 years post BSN. They will complete in-person clinical hours and pass certification exam in the area of specialization. It's very important to focus on the clinical hours. As I will discuss later on, we have problem. We are calling our masters as clinicals, but they don't have clinical or enough clinical hours. CNS salaries. CNS salaries are range from 95,000 to 106,000 per year. CNS responsibilities include, there are a lot, but I'm just highlighting the most important clinical responsibilities. It's performing health assessment and developing specialized training plans or treatment plans, develop a nursing practice, policies and procedures, because they can be in administrative roles, considering differential diagnosis and making clinical recommendations, administering medication and treatment in consultation with the patient care managers, identify training needs and facilitation training for nurses, for nursing students and staff. Now I'll be talking about the NBs. NBs can write prescription for controlled substances, order lab tests and diagnosis. They can have their own clinics. Their exact responsibilities are vary according to the scope of practice is up on their state laws and regulations. This means that there is no scope of practice determined for all nurses in the United States. It's vary according to the state laws and regulations. However, they all have their own clinics, they prescribe medications. NB's educations, it's like the CNS, they will be, the program is 2 to 3 years, post BSN. Again, they have to complete in-person clinical hours and pass the certification exam on the area of specialization. If they are specialized in family, they have to pass exam in their specialties. Their salaries range from 119 to 120,000 per year. Again, this number is not it's not exact because it varies according to the states and according to specialty. See, in like NBs in cardiac, they will be paid more, but in other specialties they will be paid less. But this is the range. Anyway, if anyone interested, he can just go, and I will give you the website. You can go and look at yourself. طيب. After the APRN, or those who graduated from the APRN track, they can go easily for the DNB. In 2006, the American Association of College of Nursing established the DNB. DNB working in administration or direct patient care as APRN. And again, there is a difference between a state to another state. You could go from bachelor degree all the way to the DNB, or sometimes it's required you have to have a master, then you can go for the DNB. DNBs, they can work in the organization leaderships, nurse management, state and national health policy, and also they can work in the health informatics. DNB education, they will be studying 3 to 6 years, according to whether the program is full or part-time studies. Most of DNB's programs require that master degree, but not all of them. You could go from the BSN to the DNB. However, the duration of the program and the clinical hours will be more than the compared to if you have already your master. DNB salaries could be the highest, I think, in the United States. It's the average is 126,000 per year. Again, this number is range according to the specialization and according to the state. Now we'll be discussing very important aspect, and we need to be clear about it. There is, I don't know if you can call it rumor or misunderstanding or misconception that when you talk about non-clinical, who is non-clinical? Many believe that non-clinical are the professors who are working in the university because they are not in contact with the patients. So these are non-clinical, so they don't have to be registered in the Saudi Commission. But if you go to the literature, non-clinical specialties is varies. I believe it's more than 30 specialties. It's considered or labeled as non-clinical. One of them is a manager. But I will just give examples here. I believe it's 7 or 8. Legal nurse consultant. They are not in direct, they are not giving direct patient care. Public health nurse, nurse educators, nursing informatics, nursing admin, and clinical nurse researchers. I just want to make it clear that when we talk about non-clinical, it's a wide range. It's include the professors anyway. But my presentation today, it's about non-clinical advanced nursing specialties. It's a MSN, non-clinical MSN degrees, and the PhD. What do you mean by non-clinical MSNs? Again, here I think we have in this country we have problem with defining the non-clinical MSNs. Graduates who are prepared to function in leadership role in a wide range of healthcare settings by studying nursing leadership, nursing theory, nursing research, nursing healthcare policy, and advanced practice concepts. As I mentioned, MSN, it can be clinical and non-clinical. A clinical, we sit with the APRN. Non-clinical, it will be theoretical basis. They will be studying more research, where if you go back to the MSN and the APRN, they are not studying research, they are focusing on the evidence-based practice. And the non-clinical, their path is to do a DNB. Sorry, I'm talking about the clinical. Their path is to do the DNB after they earn their master. For the non-clinicals, after they get their master, they can go directly to the PhD because they already studied research and theory and philosophy. Non-clinical MSN graduates, salaries, nursing admin, it's 101,000 per year. Nursing educators are on the list, 77,000 per year. Nursing informatics, 79, and nursing researchers are almost 100,000. After we finish the non-clinical MSN, now we move to the PhD. PhD is a terminal nursing degree. As I discussed a while ago, PhD, it's discovered to work in the evidence, while the DNB, they apply the evidence. PhD, they work in the research, the DNB are applying the evidence. Career opportunities, they can be academia, research facilities, hospitals, and agencies. Now we need to go back to Saudi Arabia. What is our need and challenges? The current statistics show that Saudi who have postgrad studies are only 1%. The goal by 2030 is to increase it to 3%. This means that within less than 7 years, we have to triple the number. Do we have the capacities? Considering that we have faculty shortage, and the faculty shortage, by the way, it's not something new or specific to this country, it's global wise. But although we have nursing shortage, we could go over it by doing something. I will discuss it later on. But the major problem in our current MSN, we call them clinical, by definition, clinical MSN, like critical care. By definition, they should be clinical. But in reality, they are not clinical. They are more non-clinical. Why? Let's discuss it from a quality and quantity. When you talk about a quantity, how many numbers of clinical hours? Very low. Take, for example, critical care, master in critical care. I'm sure it doesn't go beyond 200 hours in the whole program. Where is the recommendation to be at least 500? 500 clinical hours. When you talk about the quality, even sometimes you have huge number of clinical hours, they doesn't reflect the reality. You could have a huge number, but they are working or practicing in the lab. This is not considered clinical hours. You could have a huge number of clinical hours, but what's the quality or what kind of clinical hours they are doing, observing? It doesn't count as a clinical experience. Do we have a clinical supervision? Who is supervising them? These are all what we need to pay attention to them in order to improve the quality of our MSNs. Again, do we have a scope of practice? None. In the United States, you have a scope of practice for state to state, you have different scope of practice. Unfortunately, in this country, we are still working in the scope of practice, but we need to work on it. Salary of MSN, whether you graduated from clinical or NBs or admin, your salary is the same. So this is disappointing facts for our nurses. And the academic, according to the National Qualification Framework, all master, they fit in this level. They all are in the level 5. It doesn't matter if they are NB or CNS or admin. They all fit in one category. Disappointing. We have to have a different category for each track. Done. Specialization. Saudi Commission. All masters, whether NB, CNS, admin, they are senior specialists. So what's the point for our nurses to go for NB that can last for 3 years, where they can do clinical or admin in 2 years? I mean, as soon as they're going to be having the same classification, this needs to be changed. What needs to be done? I discussed some of them. We need to work on the scope practice. And this role is from the Professional Council for Nursing. And Saudi Commission, they have to work in the scope practice and they have to publish it soon. We could also work in a fellowship track for APRN. And this needs to be done from the Scientific Council for Nursing, because this is not academic degree. Why do we need to do or to have a fellowship program track? All our nurses who have finished their master, they will get, or so they will be specialized as senior specialists. Till two things, till either they die or they go for a PhD to get a consultation. There is no way to be specialized in consultant unless they have their master, PhD. We could open a door for them that they can go with the fellowship, and they can, at the end of the fellowship, they can get, or they can be specialized as a consultant. We need to work on the salaries and the privilege, and this needs to be done from the Ministry of Human Resources and Social Development. Conclusion: the number of Saudi with postgraduate degree is minimal. We have to increase the number of postgrad students. We need to open more postgrad programs. Unfortunately, you have faculty shortage. We cannot do it. But I cannot understand. I mean, I understand that we have faculty shortage, but there are many options we can go over it, like joint programs. What do you mean by joint programs? I myself did my PhD in America. I graduated from Kent State University. Kent is a very small village. They cannot afford to have their PhD program. Beside Kent, there is another village called Akron. They join together and they have a joint program. I myself enjoyed it. One semester I will be studying in Kent. The next semester I'll be studying at Akron. I myself enjoyed it because even they are in the same geographic area, believe me, each university has its own philosophy and culture. I cannot understand why we cannot join and have joint programs between Al-Ilm University and King Saud University, Noura University and King Saud University. It's not shame to have a joint programs. We need to work on that. This is this is a way to be cost effective and be utilizing our resources. We have resources that underutilized. In the joint program, we can utilize it. Do we have time? Last time, okay. Joint supervision. Okay, in King Saud University, we have a PhD program. No other university have joint program. PhD program. Our problem is not with teaching students. We could have 40 students teaching them in one class. Our problem with the supervision. We could have joint supervision. We could have a supervisor from King Saud University, King Abdulaziz University, from Princeton, Noura. I don't see a reason why we don't have a joint supervision. And finally, a fellowship program, it needs to be done. And I would like to see it soon, but it's not academic program. Thank you for listening.
Thank you, Dr. Thank you for the presentation. It shows the diversity of the degrees. To be honest, I did not know that. I just got to know it now. So that is very interesting. And we will leave it for the discussion, the joint supervision and the joint programs, because there are other programs that they do that. Inshallah, we can do it for the nursing. Now, the third speaker is from our college, Dr. Khalid. Everybody knows from my college, I'm always proud of my faculty and I'm always happy when somebody joins us. So Dr. Khalid, he just joined us this year. And thank you for choosing us and joining us. Dr. Khalid Al-Mughid, he is an assistant professor in nursing at the College of Nursing and Riyadh Al University. Dr. Khalid, he graduated from Jordan Science and Technology University. So we have all of you speakers from Jordan, interesting. And then in 2018, and then he obtained his master's degree in 2017 from Near East University in the field of adult health nursing and critical care, followed by a doctor of philosophy of nursing, again from the same university, Near East University, which is in Cyprus, in February 2021. With a full scholarship earned by Erasmus Scholarships, which is the European Union. Dr. Al-Mughid worked in different job titles, starting from staff nurse, clinical instructor, lecturer, research assistant, and currently as an assistant professor. His current research interest is patient safety, attitude nursing, compliance, nursing education, and nursing care. So تفضل Dr. and thank you for joining us.
بسم الله السلام عليكم جميعا. بارك الله فيكم على اختياري حتى أشارك في هذا البرنامج الناجح إن شاء الله تعالى. First of all, my name is Dr. Khalid Anwar Al-Mujid. I am Assistant Professor of Nursing. Today I will present my topic, values and ethics in nursing, which is the most important of nursing. By the way, before I start my presentation, I want to ask our student, why the value and ethics is important for nursing? Can we work without value and ethics? Why no? Can work as work. I do my job and live. It doesn't matter the outcome. So it is like our umbrella. The ethics and value, it's like our umbrella. So we cannot. So the ethics and value, this is our umbrella. So my objective today, I hope my audience at the end of this presentation will be able to explain how cognitive development, value moral frameworks, and code of ethics affect moral decision. The second one, discuss source of ethics problem in nursing. The third one, explain use and limitation of professional code of ethics. And the last one, explain how nurses acquired and clarify personal and professional values. So let's start about definitions of value in general. The value are enduring belief or attitude about worth of a person, object, idea, or action. The value affected decision and action of nursing. For example, nurse ethical decision making. So the nurse not only for a practice. So we need to consider and parallel our practice with the ethics. Also, the value can be in 3 dimensions. The first one as a personal, the second one societal, and the third one is professional. In the societal, people need a value to feel accept. That's meaning my value, it can be accept for anyone. The personal value, a person internalize some or values that are deriving from society. People, on the second one, people need a personal value to have a sense of individuality. As a professional value acquired during society into nursing from codes of ethics, nursing experience, and teachers. Values as a beliefs, we feel it as a beliefs. Beliefs are interpretation or conclusion that we will accept as a true. They are basically more unified than facts. For example, when I'm in the general beliefs, if I study hard, I will get a good grade. It is just believe 1 + 1 equal 2. But as a value, make it a sense for me, a good grade as important to me. I must study hard to get a good grade. Value as attitude. Attitude as a mental position or feel toward a person, object, or idea. Acceptance, for example, as acceptance or openness. Attitude as a judge, as a good or as a bad, or positive or can be negative. Have a thinking or behavioral aspect are and vary among as an individual. Value, it can be transmission. It can be transmission from second to first to second. Value are learned through observation and experience. Values are heavily affected by person's culture and environment, like a culture, religions, and family. For example, if a parent demonstrates honesty in dealing with others, definitely the child will respect and demonstrate a value honesty. والعكس صحيح. Values, clarification. It can be clarification in general. Also, it can be clarification for a nurse. Is a process by which people identify and examine and develop their own individual value. No one set of value is right for everyone. It can be changed from country to country or people to people. When people examine their value, they can retain or change them. Value clarification promotes personal growth by fostering awareness, empathy, or insights. As a nurse, as a clarification for nurse hold both personal and professional value about life, death, health, and illness. For example, about abortion. Abortion in our country as a Muslim, is it halal am haram? ليش؟ طيب مش كل حق واحد له إنه يأخذ قرار؟ نعم. قتل نفس. إذن it's not allowed in our Muslim. In our country, Muslim is not allowed abortion. Okay, so can I accept this? What would I in this situation? So our general answer is not accept. Maybe in another country, non-Muslim, they feel it's accepted. But in our country, as a Muslim, no, we ignore this one. Clarify client values. A nurse can explore a client value through the discussion if the client holds unclear or unconvenient value. Example of unclear value, for example, a pregnant woman say she wants a healthy baby. She wants a healthy baby, but she's still continuous smoking. Is it clear? So what is the correct decision? She must stop the smoking. For example, middle-aged obese woman repeatedly seeking help for back pain, but does not lose the weight or does not make exercise as evidence she make or effort to reduce his weight. As an ethics definition, as a study help people to understand the morality of human behavior. A practice our belief of certain group as a medical or nursing. The expected standard of moral behavior of particular group of professional as described in Code of Professional Ethics. Nursing ethics is a formal statement. As I've said before, it's our umbrella, the nursing ethics, for a group in idea and values. It is a set of ethical principles that's shared by members of a group, reflect their moral judgment over time, serve as a standard for their professional of action. Code of ethics usually have a higher requirement than legal standard, and they are never lower than a legal standard of the professional. Why we use the nursing code of ethics? Why is it important? First one is inform the public about minimum standard of professional commitment to public, outline the major ethical consideration of a professional, provide ethical standard for professional behavior, guide the professional in self-regulation, remind nurses for their responsibility when caring for the sick. So our also American Associated of College of Nursing have identified for us 5 values. Altruism. Altruism في العربي يعني الإيثار. Here it's the one recommending ethics in our religion. A concern of welfare and well-being of others. Autonomy. Autonomy. The right of self-demonstration. Nurse must respect the client's right to make decision about his health, a human dignity, a respect for inherent worth and uniqueness of individual. For example, nurse must value and respect all patients and colleagues. Integrity, practice nursing in according with appropriate code of ethics and expect standard of practice. For example, nurse should be honest and provide care based on ethical framework. Social justice. This is a fair treatment regarding race, age, and economic. Just for example, I am a nurse, only can make a treatment for example, the Muslim nurse or Muslim patient. Is it allowed or true? What do you think? I am Muslim, only make it, I am Muslim nurse, make a treatment or provide a treatment for only Muslim. Is it true? So the nurse can be always are equal. A&A revise the scope standard of the practice, drive care in manner that receive project client autonomy, dignity, and rights, value, and beliefs. Uphold the client's confidence with the legal and regulatory parameter. Maintain a therapeutic and professional relationship with appropriate professional role boundaries. Now we have some ethical principle. In ethical, this is we must work going on. Ethical principle, autonomy. Autonomy, the definition of autonomy is the right to make one's decision. Non-maleficence, do not harm. Beneficence, doing good. Justice, obligate to be fair. Validity, to be faith to agreement or promises. Veracity, telling to the truth. Accountability and responsibility, answerable to self and other. For example, autonomy. So the patient have rights to select her or his decision for the treatment. For example, the nurse must be recognized that each client is a unique and has the right to be what he or she is the right to choose personal goal. Respect the client decision, even if the decision according to nurse are not be interest. Also, the third one is important, informed consent. We cannot do any procedure without the informed consent. Non-maleficence. Non-maleficence is, it can be in the 3 types. Intentional harm is never acceptable. It does mean and make dangerous or incident for the patient. Placing any client at risk can be happened. For example, during workload or fatigue, it can be. Unintentional when the nurse, when the risk could have not be anticipated. Beneficence. Nurses are obligated to do good action that benefits client and their support. Good action can pose the risk. For example, nurse can advise the client to do exercise to improve health, but should not do it because the patient have heart attack. So the exercise in this time, not recommended. For example, just al-adala. Nurses are faced with situation where a sense just should be demonstrated. Okay, let's assume we have one example. Let's assume we are in the disaster situation and your patient and you have 2 patients and you have only 1 ampoule of medication. This ampoule of medication contains 3 ml and you have 2 patients. One of the patient is one of your relative, mother, father, sister, and the second one is unknown patient, is patient. And both of them need the medication. Both of them need the medication and you have 1 ampoule. What should you do? Let's see. Discuss. You have 1 ampoule, both of them need this medication. One is your relative, father, mother, The second one is patient, unknown patient. What do you think? ما في لهيب. Come again? Thank you, doctor, but I need the student. I respect your decision. Okay. I need the student. Sorry, doctors. Yes. One. تقسمها بينهم. طيب هذاك يعني father, mother أقرب من أولى بالمعروف. Come again. So, yes. الأخلاق ما تسمحنا. إيش لازم نعمل يعني؟ نقسمها في النص. إذن هو الجواب الصح نقسمها في النص. نقسمها في النص. الجواب الصح نازل لأن العدالة. لكن الآن إحنا نتكلم، لكن في الحقيقة هل نطبقها؟ لا. تمام. I hope no. I hope to be considered to be just. I hope to be just in the future, inshallah. Fidelity to be fifth to agreement and the promise. Nurse, for example, nurse make a promise such as I will find out for you about your medication, or I will back with your pain medication. Which is like, for example, you have a lot of patients. Some patient, please give me medication. Okay, I will back for you, and you ignore it. This is no. It's not recommend. Veracity, telling the truth, telling the dying person he is dying or not, or lying to sick people when a lie relieve an anxiety or fear. The last slide, accountability and responsibility. Accountability is answerable to be self on other for once our action. The responsibility, the specific accountability associated with the performance of a duty and particular role. Thank you for listening. I hope you understand and get more information. Thank you. Dr. Hani? يا رب.
Thank you, Dr. Khalid, for highly ethical lecture. It's interesting, really, when you think about it and you think, what are you going to do truly? If it's that, or are you going to say, tell a dying patient you're dying? You might say, okay, I'm telling him the truth. So this is the dilemma. Thank you for more dilemmas. So now I'll ask the speakers to come in to the stage and we'll have a discussion forum, please. تفضل. If you have questions, okay. Can you hear me? So if you have questions, just raise your hand and they will be with you to ask you.
السلام عليكم. السلام عليكم. اعذروني صوتي تعبان، بس باسم الجامعة لازم أشكر الدكتورة تهاني كلية الصيدلة على اللقاء الجميل، ورحب بالمحاضرين، رحب بالدكتور حمود وكافة الزملاء. جزاكم الله خير، لقاء ممتع جدا. I'm sorry, I would like to contribute, but I would have to do it. I have to welcome you all. Thank you so much.
Shukran, Dr. Salamtak. Okay, before we start, I have a couple of questions. تفضل دكتور. تفضل.
السلام عليكم. الله يحييكم جميعا. سلطان بن الرمال، عميد شؤون طلاب. My background is dentistry، لكن صراحة I enjoyed المحاضرة اليوم. First of all, we'd like to thank مركز خدمة المجتمع وكلية التمريض وأيضا طلابنا في الأندية الطلابية على التنظيم. فخورين صراحة في ممرضين المستقبل خالد ودنيا وأمان وجميع الطلاب اللي موجودين إن شاء الله اللي نشوفهم إن شاء الله في أماكن مرموقة إن شاء الله. عندي بعض الأسئلة نفس ما أنتم عارفين. يعني الأسبوع هذا يوم الأحد فتح التقديم على برامج الدكتوراه في جامعة الملك سعود وبرامج الماجستير، فودنا من المتحدثين يعطون نصائح لطلابنا اللي موجودين الآن سواء كانوا في فترة الامتياز أو في السنوات الأخيرة، كيف الواحد ممكن يجهز نفسه للقبول في برامج البوست جراد سواء كانت داخل السعودية أو خارجها. اللي يعرفوا في 8 برامج ماجستير ممكن تصححوا لي في التمريض في الملك سعود، وبرامج برنامج واحد دكتوراه، وأيضا برامج الدكتوراه خارج السعودية. فسؤالي فقط كطالب في مرحلة التمريض في المراحل الأولى وفي المراحل الأخيرة، كيف أجهز نفسي؟ إيش الاختبارات اللي ممكن تفيدني أو تساعدني في زيادة فرصي للقبول؟ إيش الأشياء اللي تنصحني فيها أنا كطالب تخلي فرصي إن شاء الله تكون أكثر؟ الله يعطيكم العافية جميعا.
أشكرك دكتور على السؤال. أشكرك دكتور على السؤال. طبعا احنا عندنا في الكلية 8 برامج دراسات عليا في الماجستير و9 دكتوراه. طبعا نصيحتي لأي فريش جراد لا تستعجل في التقديم على برامج الدراسات العليا. take your time، خذ الاكسبيرينس، شوف يعني ركز على تخصصك. where do you see yourself؟ الآن أنا مثلا بعد سنة مثلا من التطبيق في المستشفى قد تتغير الطالب يا دكتور أول ما يتخرج من البكالوريوس ما يكون عنده إيمج واضح على تخصصه. أتكلم بكل صراحة، يعني الشخص قد لا يجد نفسه في أي تخصص. إنه نعرف البكالوريوس التمريض هو بكالوريوس عام، الدراسات العليا هي تخصصية، فتخصص الشخص لا يظهر إلا بعد الممارسة على الأقل 2 سنين. يعني قد يكاد الشخص مثلا يجد نفسه في مثلا في الطوارئ، في العناية المركزة، في مثلا أقسام الأقسام المختلفة. فأنا نصيحتي الشخص يجب أن يأخذ وقته 2 على الأقل as bedside nurse، بعدها يتقدم للدراسات العليا. طبعا تقديم الدراسات العليا دكتور يعتقد أو يختلف من جامعة إلى جامعة، لكن نتكلم عن جامعة السعود مهم جدا اختبار القدرات، وهذا ما أتوقع الطلبة عندهم مشاكل في القدرات. طبعا يعتمد على الGPA، وهذا مهم جدا أن الطالب يحافظ على GPA عالي. لكن صدقني دكتور أنه الخبرة الكلينيكية لها وزن، إذا ما هو مساوي للGPA قد يكون أحيانا أعلى من الGPA، لأن الطالب قد لا يكون يأخذ الموضوع سيريس أثناء الدراسة، لكن بعد الدراسة طالب بدأ في المرحلة الكلينيكية يأخذ الموضوع سيريس، فيكون عنده كلينيكال اكسبيرينس أفضل. احنا في الكلية نقدر أو نقدم أو نفضل بالمفاضلة طالب عنده 5 سنوات كلينيكال اكسبيرينس على طالب فريش جراد، بغض النظر عن الGPA وعن الدرجات الأخرى اللي يمكن يحصل عليها الطالب.
اوكي، انا الكويستشن مني، انا اتكلم بالعربي. تكلمت على الجوينت بروجرامز والجوينت سوبرفيجن، اوكي، للدراسات العليا. يعني انا استفساري لما كنت انا بدرس الدكتوراه كانت جامعتنا موقعه مع كليه العلوم جامعه الملك سعود، وكان عندنا طلاب اللي هو الجوينت بروجرام. كانوا يجوا هناك بجامعه ابردين فتره ويرجعوا على السعود فتره، وعندهم مشرف بسعود ومشرف بجامعه ابردين. وليش ما مثلا اشياء زي كذا تطبق بين الجامعات داخل المملكه؟ I think هذه حتعمل بولينج اكثر للسوبرفايزرز من انه تكون خارج المملكه. ايش وجهه نظرك؟
طبعا صحيح دكتوره، احنا بالنسبه عندنا في جامعه الملك سعود نتكلم عن الجوينت بروجرام، هذا جامعه الملك سعود مع جامعات اخرى عالميه، فالطالب يكون له مشرف في الجامعه ومشرف خارجي في الجامعه الخارجيه. لكن انا كان حديثي عن الجوينت بروجرام الداخلي، أنا أتمنى يكون فيه joint programs ما بين جامعة الملك سعود وجامعة رياض العلم سعود وجامعة الأميرة نورة، جامعة الملك عبد العزيز، جامعة الإمام، كل الجامعات هذه يجب أن يكون فيها joint programs و joint supervision علشان احنا برضو together نقدر we can utilize our resources. لكن individually كل جامعة لوحدها أتوقع أن هذا يعني waste of resources في underutilize of our own resources.
A suggestion يعني if a data bank pooling كل supervisors who are willing to supervise from different universities هل هذا حيسهل الأمور أكثر؟
طبعا من دكتورة الجوينت سوبرفيجن هو أسهل من الجوينت بروجرامز لأن الجوينت سوبرفيجن هي في معايير معينة في الجامعة واي واحد اي عضو هيئه تدريس انترستد في الجوينت سوبرفيجن he can contact us we'll direct him how he can contact us, can contact Dr. Abdurrahman or any one of us. We will direct him how he can or she can upload her CV in the database of King Saud University, and we'll be more than happy to have him or have her as a supervisor.
Dr. Abdurrahman, you talked about the three paths of nursing education. Which of these paths you really support and why? What is the advantage of نظرك?
Thank you, Dr. Tahani, for these questions. This is very, very important. These three paths, I think, if we look to our history, as I said previously, it was very important in that time because we want to cope with the clinical practice. We are in a high need for that. However, nowadays, I am really supporting all the institutions that giving or all the nursing schools and institutions need to be supervised by the Ministry of Education because we have a duplication in the supervisions, we have the duplications of how we can know what is the product of these institutions. For example, as we can see now, there are some semi-governmental hospitals that they have them on programs. We don't know about the productivity. We don't know about the outcome of this program. If that all fall out and be under the Ministry of Education, the supervision will be there. We will be able to know and measure the programs, and the ministry will be able to know the future plan also for the postgraduates or the undergraduates. So I'm really supporting one institution or one organization in the country to have this supervision for all the nursing programs.
شكرا دكتور. Dr. Khalid, I have a question. You mentioned ethics. Okay, and you gave that example. Okay, example عليك معايا. Let's say, okay, you had the 3 mls and you gave it to not your family. How are you going to deal with it emotionally
No.
and psychologically? You're going to be affected يعني.
شكرا لك. بس للتوضيح احنا حكينا انه في عندك 1 امبول وعندك 2 بيشنت، واحد منهم اقاربك الدرجه الاولى، اب، ام، اخ، او عندك مريض عادي مريض عادي يجي يتعالج، وكلاهما يحتاج هذا العلاج. فمش من الموقع اني الله انطي الاقربون اولى، لا والله سايكولوجيكيا الان اني اقرب لاهلي، يعني كسايكولوجيا انه والله اهلي الحق انه بهذا العلاج. ولكن من باب العداله ومن باب احنا بس نتخرج حنحلف قسم، ونحلف قسم العهد التمريض ابو قراط عهد التمريض او عهد ابو قراط، فهذا يحق لنا انه نكون عادلين في اتخاذ اجراءنا واتخاذ الديسيشن ميكينج. هذا هو يعني ان شاء الله جواب له.
Do you have any questions, audience? Okay.
السلام عليكم.
عليكم السلام.
أنا طالبة خديجة برناوي رحمة الله سينيور يير. عندي سؤال. أنا كطالب خريج الآن كيف أنا ألقى يعني أفضل كأفضل بوزيشن ممكن أحصله في حياتي، أو كأفضل CV ممكن أقدمه لأي مكان في العالم؟ أوكي، التمريض عندنا يعني أنا من نظرتي إنه التمريض عندنا ماخذ رؤية ثانية ونظرة ثانية، وإن شاء الله إنه راح يتحسن للأفضل مستقبلا. بس أنا كطالب تمريض هل يعني عندي سؤال، هل أنا ممكن أشتغل في الكلينيك الأفضل أو في الإديوكيشن الأفضل لي أنا كشخص؟
Yes, can I answer that? Sorry. Thank you very much. It is very important questions for the student in this level because they want to determine what they want to do for the futures. It is very important to build that from now. And actually, we are encouraging the student to explore to different departments when they go for the clinical practice, because we want them to know where is themselves, where they found themselves can work more. For me, when I started, I was in pediatric emergency. However, when I changed to King Faisal University, they put me in hemodialysis. And I wasn't interested in hemodialysis. That's why when I finished my bachelor degree, I asked the hospital to be working only in critical care because I was interested to work in critical care. And I saw myself, this is my path. So you need to focus more when you get to the clinical practice where you want to work, because especially nowadays we have the Saudization program implemented in most of the hospitals. They have 1-year programs that they will put any graduate nurse in this program, and then they will rotate them in different departments. So when you finish this 1 year, you will be able to determine where you are going. And by the way, nursing fields have a very secured for the futures, because as you can see, I graduated from diploma and now I have my PhD and I am already associate professors. Nearly I will be, inshallah, for professors. So the path is very clear for you. The future for you is really there, but it will take time. Yes, you can build it from day one when you get for your clinical practice. So I support that for most or all the nurses that they graduated not to move directly to the educations. They have to have experience, as Dr. Hamoud said previously. They have to go there. They have to explore what are there in the clinicals. And then if they saw themselves that they are not in the clinical at all, then they can move to the educations. And by the way, there is a CNS, clinical nurse educators in the hospitals, that they work only to educate the nurses in the department. So this is one chance for you to see and practice yourself and see how, if you will be involved in educations or in the clinical. So the best way is to go and focus in the clinical practice first. It will give you the options. You will see yourself where you are able to do. And then from there you can go. And I encourage all the students to have them continuous education. Don't stop. You need to go back and read more. For all the books that our faculty here, they provide for you and they give you the chance to go and read. I know Dr. Tahani, she is emphasizing that you need to go to your textbook. And this is very important. From my experience, and maybe my friends also, they know that when we graduated and we go to the clinical practice, we need some information. So that's why we get back to the textbook and we read about the cases. So it is very good to have this experience from now. And good luck, inshallah, for your future. I am sure that you will find yourself in a very good position, inshallah, but keep time.
Thank you, Doctor. I will add to that also my experience. When I graduated, I went to the hospitals. I worked in the National Guard Hospital for 2 years. The whole 2 years, I have my books with me in the clinic. The books I'm always reading and updating. After 2 years, then I decided I want to go into academics. My friends, they went into other clinical specialities. So you have to start in the hospital and then choose what you want after that. You might go back to academics, do your master's, your PhD, or do some kind of clinical specialities. It depends. but your starting point is the hospital. And from there, you can branch out to wherever you want. Okay. I have another question. You were talking, Bardo, about the number of hours and training. You said the master's 250 or 500 hours. Is there a specific benchmarking for the hospitals and the internship for the nursing, or just any place will do, or any specification, or is there something special?
There is no specific number for how many clinic hours. It's varying from one university to another, but the cut point shouldn't be less than 500 hours in each program. But some programs, they can go even to 800 clinical hours in each program. So the range is from 5 to 800 according to the program philosophy and mission. Yeah. The most important, it's what kind of clinical competencies that those nurses are required to finish by the end of the program. So it's not really about the number per se, but it's about the competencies, the clinical competencies that they have to finish at the end of the program.
Okay. Victoria.
I was going to ask you actually. Yeah, تفضلي.
Thank you. When it comes to picking the hospital as an internship year, how do I actually pick the suitable hospital that I want to practice in for like a whole year?
Can I answer?
Yes.
Go to King Faisal Hospital. I am very pleased with it. But because King Faisal Hospital, I will tell you why I'm choosing that hospital. It's because it's focused more to the clinical practice and continuous educations. I am evaluator, as I said, in the Saudi commissions. I can pick up the person, even he did not tell me that he is from King Faisal Hospitals, National Guard, Military Hospital, and from Ministry of Health. I can determine this person is from these organizations by the answering the first two questions, because they are really emphasizing on continuous educations. When I want to renew my contract, and the contract was yearly, I need to finish at least 18 courses through the year. That's why you will be updated all the time, and your knowledge will be updated all the time. However, if you are looking also for the payment, King Faisal Hospital is different from other hospitals, because the payment scale in King Faisal Hospital is a little bit up than others. So this is another point to show you that why I choose King Faisal. And when I was staff nurse 1, I did my bachelor degree. I work in King Faisal Hospital. I get my master also, and they let me to work as a staff nurse 1. They did not promote me directly to be a program director or nurse educators. But by that time, with the BSN, I was receiving almost 17,000 per month, which is good amount.
Another option of a hospital, like second option. The first one is King Faisal. The other option.
I will be biased now if I will say that, but I will give it to Dr. Hamoud.
I just want to elaborate on what Dr. Abdurrahman was saying. In King Saud University, before the students graduate, every year we have what they call it internship day, where we invite all the hospitals to present they will present their internship program, and they will present the career path for the graduates. So based on that, each student will choose the hospital that fits his or her needs. That's why we are not endorsing any hospitals, but students, when they choose their hospital, they are obligated to finish their internship in that hospital, and with exception in some cases that need to be discussed and make a decision based on each case. But we have an internship day where all the hospital will come and they will present their internship day, internship program, and the career path for graduates. And based on that, the students will choose their program.
دكتور عبد الرحمن تفضل.
Assalamu alaikum, respected deans, respected speakers. Thank you actually for a very informative workshop today. معاكم عبد الرحمن بن دحام السفان مدير مركز خدمة المجتمع والتنمية المستدامة في جامعة رياض العلم. Actually my question directed to you respected dean. هل ممكن تشرحين للطلبة اللي موجودين معنا أو حتى ممكن في بعضهم internship أهمية البحث العلمي في تخصص التمريض؟ وهل تنصحين طلبة التمريض بتسجيل في for example summer research school زي اللي موجود ومعروف ومتعارف عليه؟ وكل الشكر والتقدير لكم.
شكرا دكتور عبد الرحمن. Yes. Okay, so just a small background. I established or أتكلم بالعربي أسست برنامج رياض العلم للأبحاث الصيفي. هو برنامج مدة 6 أسابيع تأخذوا فيه محاضرات وتعملوا فيه أبحاث، نهايته يكون فيه بوستر competition. طبعا الريسيرش هو الأساس كل شيء. If we don't do research we will never develop. يعني make it simple. الكتب اللي بتقرأوها كلها based على research. كل فترة وفترة نقول لكم we need an updated book، صح؟ We go look articles اللي هي الجديدة الأحدث، لأن كلها it pools in our profession. كلها it's like evidence based. I'm collecting all the evidence for my practice. I cannot أظل ماسكة مثلا practices و theories من 20 سنة. No. يعني now up to now we are going theories أقل شيء من 2-3 وأكثر من كذا. يعني إذا somebody tells me 2018 ولا 17 it's too old صارت. So this is the aim of research كجنرال إنه it gives more knowledge. You're adding more information. For you, when you do a research, you learn so many مهارات. You learn how to read correctly. You learn how to extract information, how to present your information, how to look for the questions, how to ask the correct questions. Maybe you have ideas. I'm sure كل واحد فينا, whenever you're thinking, especially the seniors, whenever you're doing any kind of practice we're teaching you in the labs, don't you think طب ليش نسويها كذا؟ ليش ما نسويها بالطريقة الثانية؟ صح؟ مو كذا أسهل؟ ليش مو كذا؟ These are the questions that are the basis of research. والresearch أهم شيء مبني على curiosity. If you don't have فضول و curiosity and ask, you cannot be a researcher. So هذه بالمختصر. And we also have دائما حنبدأ نعلن عنها السمر ريسيرش بروجرام موجود بالجامعة، محاضرات. هذه السنة إن شاء الله حيكون السنة السادسة. It's been very successful. دائما عندنا مشتركين من جامعتنا، كل جامعات المملكة، جامعة الملك سعود، جامعة نورة، وخارج المملكة من الإمارات، من الأردن. السنة الماضية كان في من قبرص، كان في من بلغاريا وإنجلترا. So it's a very diverse program, which is I really recommend. Yeah. هذا الشيء. شيء ثاني في الهاكاثون اللي دكتور حمود يتكلم عليه أفضل مني. تفضل.
طبعا جامعة الملك سعود عملت الهاكاثون في التمريض، كان الهاكاثون الأول في يوم التمريض الخليجي في العام الماضي، ودعينا جميع الجامعات تقريبا. جامعاتكم أعتقد أنهم فازوا في جائزة دكتورة ما شاء الله. ف يعني الهاكاثون هذا إن شاء الله راح يستمر إن شاء الله السنة هذه في جامعة الإمام عبد الرحمن الفيصل. ما أعرف صراحة السنة القادمة وين بيكون، بس الهاكاثون هذا في التمريض راح يستمر إن شاء الله لمدة السنوات القادمة بإذن الله إن شاء الله. فأنا I encourage all of you to participate. Why not? I encourage all you to participate in this hackathon because these are very important for you, and you will be learning a new channel, a new skills, and new opportunities, learning opportunities for all of you.
Doctora, if you don't mind, I have a question from Dr. محمد الرافعي. He sent it to me. السؤال هو: هل صحيح أن في جهات صحية دولية تؤكد دائما أن لا يقل نسبة التمريض الذي يحمل مؤهل بكالوريوس، وهل لا زال حاجة لفني التمريض؟ The question is there a recommendation from any organization, international organizations, to continue or to proceed with the bachelor degree and stop the diploma of nursing? I think here in Saudi Arabia, we start to get the recommendation of World Health Organizations. It was maybe 6 or 7 years back that they emphasize that all the nurses need to do the need to do bachelor degree. In my slide, maybe I did not highlight that, but really most of the organizations, and Dina mentioned that in America, they want to promote that the diploma nurses need to get a bachelor degree if they have a diploma. And in the country now, in Saudi Arabia, we don't have any diploma nurses, and we stop this program and we go with the recommendation of WHO. So this is very important. And تكملة سؤال الدكتور محمد، في لوائح التعليم الجديدة تعطي إمكانية خروج في منتصف من برنامج البكالوريوس ويكون في exit point. Still, there is no exit point for the bachelor degree in nursing. There is an exit degree internationally for the postgraduate, because there are some programs in United States that you can go to the bachelor degree, exit the PhD. If you are not able to proceed with your PhD, then they can give you an exit point like the master degree. So you are not required to have a master degree if you are interested to get your PhD, so you can connect it directly from the bachelor to the PhD. But if you are not able, still, Dr. Muhammad, there is an exit degree to have your master. Thank you very much, Dr. Muhammad, and I hope that I answer your questions. Thank you.
شكرا دكتور. طيب, I'll just ask a question for all of you.
No, before that, Doctora, I want to ask my two hands today, my right hands and left hand today, they are not left hand, two right hands. What is or what you expect to do in the future? And Dina already asked me, so I will not ask her again. So the question is for Khalid. What do you think you will do in the near future, inshallah, after you graduate, Khalid?
Thank you, Dr. Abdurrahman, for this great question. But in the first, I would like to say thank you, Doctor, for giving me and my college mate, Dina, this great chance. And thank you all. Actually, my idea for the future, I want to continue my master in the general surgery. Then I want to take the advanced practice nursing or the advanced critical care practice. But my question is, we know, as my small experience in nursing, advanced practice nursing in Saudi Arabia, it is able just for academic, it is non-clinical. So this is a question for you, doctors. It is maybe it will be able in Saudi Arabia as advanced practice nursing and clinical, and he can do like an American or the British.
Okay. I think Dr. Hamoud need to answer this because.
Maybe because Dr. Abdurrahman was rushing me during my presentation, but Princess Nora, they have advanced nursing practice. I should highlight this in my presentation. And the master, they have it, and they're gonna open a mail, inshallah. They promise us in a way. But I mean, there is advanced nursing practice in Princess Nora, and I'm looking forward. For the time being, it's only for female nurses, but they can open, inshallah, for males and females. I think all of us need to be learned from this experience, and we need to build on it. And I would like to see all advanced nursing practice in all universities and nursing colleges across the country, inshallah.
Thank you, Doctor. This is a question for you, Dr. Abdurrahman. Actually,
you're going to put me in a hard spot. Yalla, tfaddal. Yeah.
Actually, I wanna continue my internship and my career in King Faisal Hospital because I have experience as a volunteer in 2020. So, what do you think about King Faisal?
Wallah. This is what we want, actually. Volunteer is very, very good because it allowed you to get engaged with the organizations. So, give me your questions. Do you want to? What was the question?
What do you in the internship and the future of nursing in King Faisal Hospital?
Yes, it's bright. I think if you will go there, you will see yourself, inshallah, يعني within year, that you are in a very good positions. The Saudization office in King Faisal hospitals is really focused in Saudizations, where they have really constructive programs for the nurses who are coming there, and they follow them in the department. They have this program for 1 year, but they did not stop. They will continue with you and see how you are performing in the clinical practice. So I recommend you to go there. Inshallah, we will see you in a very big positions. And by the way, when I was in King Faisal Hospital, I joined them in 2000. Me and Dr. Hamoud in that time, there was only 3 Saudi nurses male. Me, Dr. Hamoud, and one of our colleague, he is a program director now in National Guard. So you can see how King Faisal prepared us to be يعني in a good position, alhamdulillah.
Okay, I have just 2 final questions. First question, you just mentioned it. Dr. Hamoud, how do you see the future for nursing for males in Saudi Arabia? Let's be realistic. It's always it's always female, they go more than the males, yeah. So how do you think this stereotyping could be changed?
I'm talking about, I'm relying on the experience of King Saud University. This stereotype is all over now. We have more nurses, male students, than female students. We have, this year, we have 180 female students, but we have 205 male students. So the number is increasing, and we are the largest number when it comes to the male students, nursing students in the kingdom.
Doctora, I want to highlight something. Nursing in Saudi Arabia, inshallah, will have a pride, because we are working in a project. Me and Dr. Hamoud, we work in project for almost 1.5 years now to change all the nursing practice in Saudi Arabia and the nursing educations. Hopefully, inshallah, this project is already go to Majlis al-Wizara. They study it, and now, inshallah, is in the process of accepting. The program, inshallah, or the project, will make innovation of nursing in Saudi Arabia, inshallah, hopefully.
So I'll just ask my last question. It's for all 3 doctors. Dr. Hamoud, Dr. Abdurrahman, mashallah, from your CVs, you started from a diploma and you pushed on to got your PhD, and inshallah, you'll be professors very soon. So from every one of you, what are your tips for successful nursing? How would they advance themselves? How would they push themselves? What are your tips for that? And then Dr. Khalid, also, what are your tips?
My advice is make a goal and plan for it. You will achieve it one day. My goal is to work in cardiac surgical ICU when I was having my diploma in nursing. It took me a while to achieve my goal, but finally I was able to achieve it. When I achieved it, I lost my passion from the clinical side, so I moved to the King Saud University.
Okay. Dr. Khalid, please go ahead. No. طيب. For me, I want to highlight something for our students and for the new graduate nurses. You are in Kingdom of Saudi Arabia. You have opportunity that might be not available for any nurse outside the country. The reason why I'm saying that is we have the foreigner nurses from different countries. They came and they help us. So let's take this chance and get the practice from the expert people. We are now in the beginning of nursing, advance of nursing. So we need to get the experience from these people. They have them experience from back home. They came here, and it is our time to utilize them experience. We know that They are coming here to help us in this crisis. I used to work in King Faisal Hospital. In 2000, there was 65 nationality of nurses working in King Faisal Hospital. So it was the time for me to see how are these differences. I was realizing the differences of the practice among the nationality. So in this way, it will help you to see and implement the good practice that you can see from the country that you see the nurses are effective and have a good nursing care. So please utilize them, work with them, and have them experience and knowledge transfer to you.
Bismillah. In general, some of the people are just looking for the development only when they complete their study, master and PhD. Even if you are a nurse, still after graduating from bachelor degree, you can improve yourself. For example, you can graduate by staff nurse, head nurse, supervisor nurse, nursing manager, and the end nursing director. So the development is not only exclusive by postgraduate. So I recommend you the student who she asked, his name Khadija, I think. Where is she? She left. Okay. So as Dr. Abdul Rahman said, where can you see yourself in the practice or in education. وكما نختم بها في مقولة تقول المؤمن أينما يضعه الله يزهر. فأين ترى نفسك إن شاء الله وطور منها. أتمنى لكم التوفيق.
Excuse me, Dr. Tahani. The last question. I think the good students have to think about the future of a specialty as he think about the final exam. So if the King Faisal Hospital, is there a chance there to continue our post-graduation studies? It is a big chance or not, Doctor?
As you can see, Khalid, I did my diploma and I joined King Faisal Hospital. So they sponsor me for the bachelor and they sponsor me for the master degree. Unfortunately, there was no sponsorship for the PhD because we know the hierarchy of the hospital. They want only one nursing director which hold this position with the PhD. Otherwise, they will sponsor. So it is a good opportunity for you if you will go to King Faisal Hospital, even though I think if anyone will hear me from Saudi commissions will start looking at me badly because I am biased with King Faisal. But this is the reality and everyone in nursing knows that very well.
Thank you, Doctor.
Shukran, Doctor. Also, I can add something, Tara, for King Faisal. If you don't get accepted in an internship here, you can volunteer. One of the things I did, I volunteered for 8 months actually, in King Faisal Specialist Hospital. And I used to be here, and I was a faculty member. I used to finish here by 2 o'clock, and then I go to King Faisal, stay there until 8 o'clock in the night as a volunteer. So when I went to do my PhD, I got all the skills. They trained me in the skills that I needed before I went and had my PhD. So if you don't get the chance for internship or training, go as a volunteer, and they might see you, acknowledge you, and they can offer you jobs after you do a volunteer. So if you want something, as Dr. Hamoud said, you have هدف وgoal, put it in front of you. بأي طريقة حوصل له. مو ما وصلت له بهذه الطريقة انتهى، لا، في طرق دائما للهدف اللي أنا أبغاه. Okay. آخر سؤال.
As a nurse, can I continue as a dermatologist, switch to derma? I'm a nurse, intern nurse. I want to finish, graduate, and then I want to take another extra courses as a dermatologist. Yeah.
Yes. We do want to answer you these questions. I do want you to leave the nursing. I want to keep you there. So there is a program, and but I will not tell you about it because any nurse, I want to keep him in the field. So Dina, stay there. Since I know you, Dina, mashallah, your GPA and how you present yourself here is the way that we need our nurses in the futures. Thank you.
Okay. So in the end, I would like to thank all our speakers. Thank you so very much. Dr. Abdurrahman, Dr. Khalid. Okay. خلاص. Dr. Khalid, Dr. Hamoud, thank you for coming, for making this presentation and this workshop and discussion. As usual, the discussion always is the best part. بالإضافة, I would like to thank إدارة الجامعة، شؤون الطلاب، الدكتور عبد الرحمن في خدمة المجتمع، ودائما دكتور الرافع, he's always supporting in nursing in any way possible. So thank you everybody for every effort. وأهم شيء, my students, I'm always proud of you wherever you do, and thank you again for coming. I would like to نوزع دروع الشكر للدكاترة. تفضل دكتور عبد الرحمن. يلا نظيرة. نظيرة من السعود ترى، دكتورة نظيرة. لا نظيرة.
قراءة الكتب، الطالب هل هو مضطر يقرأ الكتب ولا لا؟ يعني قد ايش حتكون مهم قراءة الكتب بالنسبة للطالب؟
If the students are focused in the textbook, they will be able to pass the Saudi Commission for Health Specialization exam, which is very important to start your career. Also, you will be able to have the enough knowledge when you work in the clinical practice. So, and it is a reference for you to go back to it all the time. So it's not something that you will do it now and that's it. So you need to continue reading, and as I mentioned previously, you will see some cases in the clinical practice that you don't know about it or you have doubt about it, then you will go back to the textbook and read. So thank you very much for mentioning this question. It's very important. Thank you.
Thank you everybody. Thank you for coming. Inshallah we'll meet again في other workshops. يعطيكم العافية. Thank you.